Hello, my name is Lee Presser. This is my show. I speak frequently to very interesting people. Some of these conversations are so exciting, so intellectually stimulating, I thought others might like to listen in. This is the reason we started recording Conversation with Lee Presser.
Welcome to Conversation with Lee Presser. Chiropractic is a form of medicine that emphasizes diagnosis, treatment, and prevention of mechanical disorders of the musculoskeletal system, especially the spine. The main chiropractic treatment technique involves manual therapy, especially manipulation of the spine and other joints and soft tissue. Treatment may also include exercises and health and lifestyle counseling. Many chiropractors reject being characterized as complementary or alternative medicine. Our guest today, Dr. Patrick Montgomery, is an associate professor of chiropractic history, philosophy, and technique at Logan College of Chiropractic. He's here today to discuss the long history of chiropractic, its philosophy and usage in today's healthcare environment. Dr. Montgomery, welcome to the conversation.
Oh, thank you for having me here.
Let's start off first by telling people where Logan College of Chiropractic is.
Well, Logan started in 1935 in the heart of St. Louis, but now it is located in Chesterfield. 3 years ago, it was reorganized as Logan University. We have two different colleges in the university, the College of Chiropractic, of course, and the College of Health Sciences. Logan College is one of the premier colleges in our profession. Currently, it's about the third largest in the United States, and we recently inaugurated our seventh president, Dr. Clay McDonald. And I've been associated with the college for quite some time. My father taught there from 1946 to 1978 when he passed away. I graduated in 76 and practiced with him until he passed, and then moved to California. I helped start a little college out there called Palmer College of Chiropractic West. And about 12 years ago, the past president, Dr. George Goodman, asked me to come back to teach at Logan because he knew I had some things that he wanted me to share with the students.
How many students are at Logan College?
Currently, the whole university has about 1,100. The College of Chiropractic is probably around 850. It is a long curriculum. It's 10 trimesters. You have to have a minimum of 3 years of college to get in, preferably a bachelor's. If you are allowed to come in earlier than that, you have to have certain classes done, mostly in physics, chemistry, and biology. The 10 trimesters at the college, we start off in the first 3 trimesters mostly with basic sciences, things like anatomy, bacteriology, chemistry, and so forth. And then right around the 4th trimester, we start getting into some of the clinical sciences. And the last 3 trimesters are spent in the outpatient clinic with a few other classes. We have currently 5 clinics spread throughout the St. Louis area. We also have a presence at the VA, at Scott Air Force Base, and also with the BJC.
How close, how do I put this? How close to a medical education are your students at Logan getting compared to if they're going to Washington University School of Medicine or St. Louis University School of Medicine?
Currently, we cover all the same classes with just a few exceptions, where the medical students will study pharmacology. For instance, in surgery, we'll be studying more X-ray diagnosis, the physical approach to treatment, such as chiropractic adjusting, other types of manipulation of the body, a lot more nutrition than they get, but approximately it's about the same number of hours, between 4,600 and 5,000 hours of schooling.
So you're saying other than surgery and pharmacology, that the medical education of a chiropractic student and a medical student are parallel?
They are. The human body is the human body, no matter who looks at it. They have the same number of bones, same number of muscles, how the body chemistry works, how the physiology works, all of this is the same. And so if we are going to treat the patient, if we're going to make the diagnosis, we have to know what's going on with the body. The patients, when they first come in, are going to ask any doctor 5 basic questions. The first one is, what do I have? And so therefore you must be well schooled in diagnosis. The second thing is, can you help me? And that is also a judgment call by the physician, whether it be a chiropractic physician or a medical physician. What are you going to do to me? And that's where things change a little bit between the medical doctor and the chiropractic doctor. How long is it going to take? And then, of course, the last question is always how much. But
that's always a good question to get answered.
And for the most part, when you're looking at musculoskeletal conditions, treatment through a chiropractor is usually much more economical than going the pharmacological and surgical route.
Mm-hmm. So, in answer to the question of what are you going to do to me,
Mm-hmm.
what's the difference between your answer and if I go to somebody with MD next to his name?
Well, the medical doctor, of course, is a doctor of medicine. He'll look at you and try to treat you from a chemical point of view. We'll give you medicine they call a drug or a pharmaceutical compound. Hopefully it'll make your body to chemistry change and help you get better. Chiropractors look at you from a more physical point of view. How are you put together? How do you function? And therefore our approach is much more physical. We can't give you, say, a bottle of adjustments and say, you take one of these 3 times a day, I'll see you in a month. You have to come into us. We do things to you. So therefore, the relationship between a chiropractic physician and his or her patient is much more close. We get to know them a lot more. We have to find out what's going on in their lives, not just how they hurt themselves, but what they do in their daily living. People live with themselves 24/7. We don't get to see them 15 to 20 minutes at a time. And so therefore we have to find out what's going on with their life in order to help them recover from the reason why they came in.
Mm-hmm. Now, somebody sprains their ankle terribly
Mm-hmm.
or twists their shoulder horribly, right?
Mm-hmm.
This is something that you would deal with as a chiropractor,
Oh,
right?
absolutely.
Now, but if they came in and their ankle was broken in 3 places, or their shoulder was like ripped out,
Mm-hmm.
you wouldn't handle that, right?
No, it comes back to the 5 same questions. What do I have? Well, you have a broken ankle. Can you help me? No, I can't. I'm going to send you out to the appropriate person. And hopefully the medical doctor do the same. Somebody comes into them, they have a physical problem that they can't help, they send them to us.
Now, that wasn't always like that, was it?
No, unfortunately. Now, chiropractic started way back in the 1800s. And back in the 1800s, there were basically 5 different types of physicians. The allopath was somewhat new. There were eclectics, which did a lot of different things. There were the homeopaths, there were the osteopaths, and of course the chiropractors. And each of us approached things differently. There was a bit of a competition between the different factions of healthcare on who could do the job the best. And the history shows that that the eclectics and the homeopaths were mostly absorbed by the allopaths, although osteopaths and chiropractors do a lot of the same type of things that the eclectics and the homeopaths did as well.
Now, these names, I mean, they sound familiar to me, but
Mm-hmm.
perhaps we ought to define, like, for example, an osteopath.
Okay.
An osteopathic doctor is a licensed physician, I don't know in Missouri or Illinois anymore, but at one time they were like side by side with MDs, weren't they?
Well,
And I don't know what the difference was. They're kind of like, almost like a chiropractor with a medical license.
Well, it goes back back in the history. Dr. Andrew T. Still is the developer and founder of osteopathy. He opened the very first osteopathic college in Kirksville, which is still in operation today as A.T. Still University. Dr. Still was looking at things, how was the body being interfered with the flow of what he considered the chemicals that the body needed from the brain and the circulatory system into the rest of the body. Mm-hmm. So they manipulated, which they still do, they manipulate in order to increase flow of blood, for instance. Chiropractors looked at it from a different point of view. We looked at it from a neurological point of view. The reason why the body was malfunctioning is that there was a disconnect between the brain and the body via the nerves. And so therefore, we manipulate what we call adjustments to free the nervous system to allow the body to heal itself. And because of that, we got into the manipulation of the spine, especially. That's our forte. as well as taking care of the rest of the body.
So you're saying that chiropractic is more about electricity of the body, or the synapse that, as it runs along the nerves, versus what the osteopaths were seeing as more chemically based?
Yes, yes. And as time has gone on, the osteopaths have evolved into two major different types of osteopaths. There's broad osteopaths and there's lesion osteopaths. Of the two, the broad osteopaths are about 95% of the profession today. They are trained just like the medical doctors. They do surgery, they do pharmacological intervention, whereas chiropractors have stayed with the more natural approach to healing.
Now, well, I know in California, way back, I think in the 60s, that the osteopaths and the MDs merged.
Yes.
And so they're all MDs now in California. Is that the same in other states?
No, not quite. I practiced for over 20 years in California, and I know quite a few osteopaths out there, and there's still a lot of osteopaths that go by the designation DO.
Oh, do they? Okay.
But about half of the organization of osteopaths at the time decided to take up the California Medical Association's offer, and they went for, I forget how much more training. It wasn't a whole lot because there's not that much difference in their training. And they were able to, if they wanted to use MD behind their name instead of DO. Mm-hmm. The rest of the country still, there's a lot of DOs out there. They're very fine doctors. I've worked with quite a few of them, and a lot of good medical doctors as well.
Mm-hmm. And chiropractors are DCs? We
are DCs, Doctors of Chiropractic.
Okay. Now let's go back again to the late 1800s. Okay. There was a fellow who had something happen when he was dealing with another guy who was having he was hard of hearing.
Ah, yes.
And this fellow's name was Palmer?
Yes, this is Dr. D.D. Palmer, David Daniel Palmer. Dr. Palmer was a magnetic healer. It was very popular back then, magnetic healing.
Magnetism was big. It was like superstition almost.
Well, it was based on that the body has an energy, and that magnetic healers thought that they could cool off the inflammations of the sick person with their own excess vital force. And therefore, and it was amazing some of the results they got. There was a Dr. Castor up in Iowa, probably the most famous magnetic healer. And it is said that both A.T. Still as well as D.D. Palmer studied under him. And they went into magnetic healing. And Dr. Palmer went from Burlington, Iowa, where he was, into Davenport in the late 1880s. And he had an office in downtown Davenport at the corner of 2nd and Brady Street. And he was helping quite a few people with his magnetic healing. And he was sitting in his office one afternoon, and he heard the two janitors outside his door telling jokes, and quite loud, because one of the janitors was deaf in one ear and hardly could hear out the other ear. Well, Dr. Palmer enjoyed a good joke like anybody else, and he went out there and started to laugh and joke with him. And he put his arm around the one man, and he says, "How long have you been deaf?" And he said, "Well, you know, I have not been deaf all my life. I've been deaf for about 17 years." And he said that he started losing his hearing after he had picked up something that was in a crowded area. He was a janitor. And Dr. Palmer did a quick examination of his back and said, "Well, let me take a closer look at you." So he brought him into his office, examined him, and Palmer was very, very well educated in anatomy, and said that there's something not quite right in your back. And he called it a vertebra that was racked out of position. And he convinced this man, whose name was Harvey Lillard, to allow him to, quote, rack it back into place. Now, it's much more crude than what we do today, but he was successful. And Mr. Lillard went back to work. And later in the day, he came back to Dr. Palmer and said, "I think I can hear a little bit better." So Palmer adjusted him one more time. They called it manipulation at the time. And all of his hearing was restored. At first, Palmer was amazed, and so was Mr. Lillard. But Dr. Palmer had quite a few patients for his magnetic healing, and he decided to start using this on some of his other patients with great results. 2 years later, one of his close friends convinced him to start to teach this, because he was teaching magnetic therapy before, but now he started incorporating this new thing. One of his patients, who was a a minister from Monmouth, Illinois. He asked him to help him come up with a new name for this. Well, the Reverend Samuel Weed came up with 32 Greek stems because he was a Greek scholar. And so Dr. Palmer went through the different stems and came up with 2 words. One, chir, means hand, and practicos, done by hand. So he coined the word chiropractic. He started to teach this. His first 17 students, with just one exception, already had advanced degrees. So it was a 3-month course. Doesn't seem like much nowadays, but 3 months back then was quite a bit, especially if you already had either a medical doctor degree or chiropractic or osteopathic degree. And he gave out a diploma that said you can go out now and
manipulate
and practice and teach it. Yeah. And all 17 ones went out there and started their own colleges, and that's how the profession got started.
So there was D.D. Palmer had a son.
Yes, Dr. B.J. Palmer.
Right.
Bartlett Joshua Palmer. Dr. Palmer, B.J. Palmer was the 17th person who did not have a degree. And he wanted to learn what his dad did. And so he graduated in 1902. The first college, which is still in existence, Palmer College, was established in 1897. And B.J., a few years later, took over the school when D.D. decided he was going to move. He moved first to Oklahoma and helped a friend down there start a chiropractic college. Eventually he moved off to Portland, Oregon, where the school he started is still in existence today, celebrating their 110th anniversary, University of Western States. Now, BJ, called the developer of chiropractic, he went on to try to really get as many people as possible to first know about chiropractic, to learn how to do chiropractic, to go out and help more people. So by 1924, the Palmer School of Chiropractic was the largest healthcare institution in the United States with over 3,000 students.
And yet, in this period that you're talking about, the 20s, the 30s, all the way through to the 60s, there was considerable angst in the medical community about the legitimacy of what chiropractic was doing, to the point where there were attempts to put a stop to it.
Oh, yes.
So talk about that.
Well, when we go back to the different types of doctors, in 1910 there was a paper that was written by Dr. Abraham Flexner that talked about the medical education in the United States and Canada. It was saying how poor it was. Many doctors of all different persuasions didn't have a formal education. They didn't go to university and so forth. Some of them just followed around old doc on his buggy for a year, and when old doc thought that you had as much knowledge as he did, he gave you a medical license. You can go to the county seat and start your practice. Well, the AMA, which had been started by that time, asked Dr. Flexner to look at all the different schools. Well, in his report, he decided that it might be best to have all doctors be taught the same way, mostly the pharmacological approach to healthcare. Well, chiropractic was deeply in the natural healing.
So before you go further,
Yeah.
when you say pharmacological, you're
Yes.
talking about medicines.
Medicines, yes.
Right, so people understand. So that's the split right there.
Yes.
The AMA believed in the medicine approach. Chiropractic believed in the manipulation approach.
Manipulation
Okay.
in natural healthcare.
And then go on from there.
And there's a lot of barbs going back and forth. We're right. No, you're wrong. We're right, and so forth. And it got to be quite testy. The medical doctors had already gotten their licensing in all different states, and they had some laws passed that said that, well, unless you have one of our licenses, you're practicing medicine on a license, because they came up with certain terms as that those are ours: diagnosis, treatment, and cure. If you said that you did one of those 3 things, you were practicing medicine. And if you didn't have a license, they then asked the local judge to have you arrested. And so by about 1922, there had been over 15,000 chiropractors arrested across the country and put into jail because they were practicing chiropractic. They weren't practicing medicine. Now, during this time, the chiropractors decided that they need to be licensed as well. to
They
help
needed
stop it.
friends in the state legislatures.
They needed friends to state legislatures, and that's exactly what had to happen. They had to go to state by state by state, because it is the state that regulates healthcare, not the federal government. So when you want to get a license, whether you be a medical doctor or a dentist or so forth, you go to the state and apply to have a license. You take a test, you show your education, and they give you a license to practice.
And yet, in 63, yet again, there was another move by the AMA to absolutely ban or bar or somehow get rid of chiropractic.
Oh, absolutely. By 1963, the 48th state to license chiropractic, which was the state of New York, passed its law. And the AMA decided that that was, we had to change, we had to do something to stop this chiropractic wave. And they started a committee called the Committee on Quackery.
Well, let me ask this. Were they threatened because you were taking money out of their pocket, or they truly thought that people who went to chiropractors were endangering themselves?
Well, if you look in the history of a trial called the Wilk trial, a lot of this came out. Medical doctors, or the average medical doctor who's working in the office and so forth, weren't the best for their patient. And they were told by their main trade organization, the AMA, that chiropractors were unscientific and they were uneducated. And they said, this is what chiropractors are trying to do. You should not try to make your patients not go to them. Fact is, there was a judicial committee, a part of the Committee on Quackery, that said if you associate with a chiropractor, we'll take your license. And they went to the American Hospital Association and said the same thing. If you allow a chiropractor to ask for x-rays to be done there or anything like that, that they were associating with cultists, and they would lose their accreditation. So it was a trade organization.
I smell antitrust coming here.
Well, it was a trade organization assuming police powers. And sometimes back then, the AMA thought they were actually a part of the government, and they're not. They're trade organizations, like the AFL-CIO deciding to put out of business, a rival. So it actually came to a head in 1976 when a group of chiropractors said, that's enough. There were 5 of them, and it was headed by a doctor by the name of Chester Wilk. And there are 5 different chiropractors. One was Michael Pettigo, who I knew from out in California. There was Jim Bryden, a chiropractor in the state of Missouri, that used to have his patients who had cardiac problems to a cardiologist. And the judicial committee told the cardiologist that if he continued to accept patients from Dr. Bryden, that they would take his license. So we had to go to court. So we went to court. There's several different battles, and it went through the different appeals, and finally came to the point in 1987 where there was a judge in Northern Illinois that said, you're violating the Sherman Antitrust Act. You're not doing this because of the AMA was, and 13 other defendants. They said, this is enough. This is not scientific to do this. There's nothing, the chiropractors are fine. They're doing a great job. Back off.
They're just doing a different job.
They're just doing a different job. It's a different approach to healthcare. You do medicines work? Absolutely. But you don't always need to run to a medicine to get the things done that your body needs. So since that time, things have changed quite a bit. There's still a little bit of rivalry, but at the same time, too, we want to do what's best for the patient. And so integrative medicine is really what's happening now. We have a group of doctors, all different kinds, all working in the same area for the best for the patient. And I think that's not just the wave of the future, but that's what's happening now.
Well, in the last 4 minutes here, I just want to say that I'm aware that there are MDs now who, while they're not chiropractors themselves, they can see a place. Somewhere they got training that says, yes, chiropractors have their place and they can do certain things that I can't do.
Yes.
So if I can't do it, go see them.
Right.
So there has been progress from your perspective then.
Oh, absolutely. In fact, I've been invited several times to talk to the medical students at Washington University as a guest speaker. And that would not have happened before 1987.
No, because then they would have been tossed out of the AMA.
Absolutely.
So what would you say to medical students at Washington University?
When you evaluate your patient and you look at the patient and see and answer those 5 basic questions. What do I have? The second question is, can you help me? Evaluate the patient, find out what's best for the patient. If it is drugs and surgery, then that's the way you go. If it is more of a biomechanical cause, a cause that can be helped by natural healing methods, send them to the chiropractor. And that's what's best for the patient.
And did you have students coming up to you afterwards to have private conversations?
Oh yes. They want to know a little bit more about chiropractic. How do we inter-refer? And it's been a very enlightening experience.
You said your students get a lot of the same training as the MD students do.
That's correct.
Do the MD students get any training similar to the chiropractic portion of your education?
Well, when it comes to the core curriculum, it's the same. The anatomy, physiology, diagnosis, X-ray interpretation, laboratory interpretation, it's the same.
Right.
The difference is where we specialize.
No, I'm saying, do the MD students get a portion of what you know that they haven't normally been taught in the past?
Usually not. Not until after they've graduated. They decide to specialize. And that's pretty much the same with chiropractic students. They do get a course in pharmacology, so they know what kind of drugs are out there. It's not that we want to prescribe the drugs, but we need to know what the drugs do to the patient.
You're not licensed to prescribe drugs,
no.
Right?
And then we don't want to. That's not our forte. That's not why we're here.
But you do supplements?
Oh yes. The education in nutrition is outstanding in chiropractic. That is one of the big differences between nutrition courses in medical school and chiropractic school. We've got several courses that are in the core curriculum. We now offer a master's in clinical nutrition, which I just finished at Logan College. Whereas in the medical schools, they get somewhere between 3 to 10 hours of formal education in nutrition, where the chiropractic students get anywhere from 60 to 100.
Well, this has been very, very enlightening. I hope that you'll have an opportunity to come back and we can talk a little bit more about the practical end of chiropractic.
I'd love to.
Thank you very much for being with us today.
Thank you very much.
And to my audience, I've been speaking with Dr. Patrick Montgomery. He is an associate professor at Logan College of Chiropractic in St. Louis County. For those of you who found this of great interest, I hope that, well, this show is going to be, like all of our shows, are going to be loaded to YouTube. So if you would like to show this to somebody else, just go to YouTube, type in the search bar Conversation with Lee Presser, and then you can search through all the shows or Conversation with Lee Presser and Montgomery, and most likely it'll come up to him pretty quick. I'm Lee Presser. We hope to see you next time. Thank you.